the financial support for the COVID-19 diagnosis, treatment, and other scopes, like Dr. Shwesan already told us. It was under the management of the National Health Security Office. And today we have an honor having Dr. Lalitaya Kongkham, Deputy Secretary General of National Health Security Office. She has over 30 years of experiences in hospital and 8 years in the NHSO. And today she will be sharing us resilience capacity of NHSO in facilitating with the management of COVID-19 pandemic. Dr. Lalitaya, the floor is yours.
Thank you, moderator. May I share my slide? Good morning, good afternoon, distinguished speakers and participants from all countries. Recently, you already have information about COVID-19 supply and logistic management in Thailand, and also COVID-19 policy disease control. This session, I will tell you how UHC, Universal Health Coverage, in response to COVID-19 in Thailand and its budget as its management in the Universal Coverage Scheme. This is the outline of my presentation. We'll focus on how Universal Health Coverage mobilize resources and management, also our lessons learned and challenges. Thailand Universal Health Coverage improve management and mobilize resources from health scheme by integrated management and budgeting of 3 main health insurance schemes in Thailand, plus additional budget from the government to combat with COVID-19. And for Thai citizens and for non-Thai, the Ministry of Public Health received the budget from the government and managed for the non-Thai people. Our Universal Health Coverage budget was allocated to cover the comprehensive benefit package of COVID-19, including active testing, tracing, treatment, home isolation, community isolation, including field hospital and factory isolation that will cover deliver food, medical supplies, and devices to patient home or community. For COVID-19 vaccine will also include management costs and compensation for adverse events from the COVID-19 vaccine. The Cabinet has priority COVID-19 to resolve the outbreak situation by approve additional budget from internal loan for COVID-19, shorten the proposing budget plan process that normally need to be submitted in advance. The first green box here is additional budget, which is about 95% of total budget we use for COVID-19. The National Health Security Office used this amount for prevention promotion program and include compensation for people who suffer from vaccine adverse event as well. Meantime, the second part, the Community Health Fund, which co-finance from the National Health Security Office Fund and the local government budget, payroll to prevention and promotion in the community level, including to support health volunteers. This slide, the budget that during the first wave of COVID-19 in Thailand on April 2020, the National Health Security Board made prompt decision to launch a new benefit package for COVID-19 and allocate UHC scheme budget for 471 million baht carry over for the fiscal year 2020. Then the budget from the internal loans was approved by the Cabinet. after the pandemic has begun in Thailand since January 2021, amount 3,000 billion Thai baht. The additional budget has been requested 4 times in the fiscal year 2021, but as the rapid surge of a new number of COVID-infected persons, it is now overspent. So in this fiscal year 2022, we request for more budget for around 24,000 million baht for COVID-19 health-related service during October to December 2021. This slide again show you the comprehensive benefit package recommended by WHO that cover for general population at risk, patient, including treatment and compensation for the people who have adverse event from receiving COVID-19 vaccine. The budget not only the cost of COVID-19 treatment, but also will provide for related health service and other services that details shown in the slide. For efficiency management system, the National Health Security Office has applied smart authentication system, health information exchange via application program interface to link the standard dataset from various organizations and set up dashboard for monitoring and evaluation. We set pre-audit system, and the very important is customer protection system by upgrading function of 1330 call center to 1330 contact center, including telephone and web registration for home isolation, bed reservation and management, telephone call to follow up the client, and strengthening the participation of health volunteer roles to enroll or can access to ensure or can access to the service system when they need. This is the impact and lesson learned from COVID-19. The good practice and the lesson learned we have got from the past will be the crucial key mechanism to prevent our country from the pandemic whenever it happens again. From this event, we have learned that COVID-19 also gives us positive impact, such as an integration, harmonization of each health insurance scheme, and or a new normal service, include digital disruption, helps us to decrease any effect in terms of accessibility to the treatment and can apply to the other disease later. People participation, civil society organization have many roles, and the proactive 1330 contact center, which are the core process when the cases are surging during the second and the third wave of the pandemic. And the last, we have to concern and prepare for the future challenge that may occur, especially the budget for the emerging disease should not crowd out the UHC system, including prepare our health information exchange system from various stakeholders to strengthening effective public financial management. Yes, thank you. Over to you, the moderator.